I'm not really feeling well. I think I have the flu.
How long have you been feeling like this?
I've been feeling like this for about a week. Since that party we went to. It was so fun and everything, but a guy invited me back to his place, and everything after that is just a blur.
Do you remember using protection?
I can't really remember.
Look, on the news, they're talking about the rise in HIV cases in the Latino population.
I didn't see that.
Welcome back to Channel 10, where our news is our top priority. There has been a recent rise in HIV cases in the Latino community, especially here in the borderland town. Tonight, Daniel has more on the subject and recommendations on HIV preventive measures. Daniel?
Thank you, Christy. It certainly is scary times we are living in. There is currently a rise in HIV cases with an estimated 36,400 new cases of HIV every year. There are approximately 1.2 million people living with HIV today in the United States, with 1 in 7 people not knowing they have HIV. Minorities are more at risk of contracting the virus, particularly the African American and Latinx community. According to recent studies, it is estimated that 1 in 36 Latinx men will be diagnosed with HIV in their lifetime. Some ways of lowering the risk of HIV include not reusing or sharing needles, using condoms during sex, getting tested regularly, even if you're in a committed and long-term relationship, and limiting the number of sexual partners that you have. Now we're going to take a short commercial break, and when we return, we'll discuss, were Ross and Rachel really on a break?
And you should get tested just to be safe.
I'm fine, really. I think you guys are overreacting.
We should go to the emergency clinic just in case. You're feeling sick anyway. Let's just go.
All right, fine, let's go.
Hi, good afternoon, sir. What brings you in today?
I've been burning up with a fever the last 2 nights, and nothing I take seems to shake this bug.
Okay. Can I please have your name and date of birth?
My name is Robert Ponce. I was born August 2nd, 1996.
Okay. All right, so I'm going to go ahead and check you in. If you can please take a seat and we'll be right with you.
Really? Take a seat. How long is this going to take?
It'll just be a few minutes. It's just so I can check you in and so the nurse can come out and see you, okay?
I'm so sorry about his outburst. He's usually not like this. He's just not feeling well.
It's okay, no worries. I understand. But we'll be with you in just a few moments.
Mr. Roberto Ponce?
Yes, that's me.
Okay, we can go ahead and follow me. We're gonna head to your room. My name is Ale, and I'm the CNA. I'm gonna be taking your vital signs. How are you feeling today?
I feel cold, but I also have a fever. I haven't been able to keep anything down. I think I have the flu or something.
Okay, I'm gonna go ahead and check your temperature, blood pressure, your pulse, respirations, and I'm gonna go ahead and let the nurse know.
Good afternoon,
sounds
sir.
good.
My name is Ashley, and I'll be your nurse today. And who do I have the pleasure in meeting today?
Hi, my name is Rob, and these are my friends. They're here for moral support. Do you mind if they stay in the room?
Of course. Nice to meet you all. So I hear you've been having flu-like symptoms that don't seem to go away. How are you?
Yeah, I'm usually never sick, and for some reason, I'm not been getting any better. I've been taking Tylenol and Theraflu. Nothing seems to help. A little bit about my history. I'm a sexually active homosexual male.
Okay. It looks like you are running a fever. Do you use protection during sexual intercourse?
I try to. My roommates think I really should get on the blue preventative pill that we've been seeing everywhere.
I'm glad that you're trying to take precautions to be safe, but before we can get you started on the PrEP pill, we will need to do some lab tests to make sure it's safe. I'll call the nurse practitioner so that he can put in the orders for that. Matt, could you put in the orders for that?
Oh yes, we'll do. To start, hi, Mr. Ponce. I'm your nurse practitioner. Regarding your so since you're at risk for HIV, we will do an HIV antibodies test to detect HIV infection. That is what was done when your blood was drawn. Later, we can confirm the test with a Western blot test. So that one's similar to the antibody test, but it's also 99.9% accurate. In the weeks after your exposure, look for symptoms like fever, sore throat, nausea, swollen glands, signs of which are like a regular infection because your body may be fighting HIV.
So, like, are you saying I shouldn't have sex? Like, why not? Like, don't you think you're overreacting a little bit? I'm sure I'm fine. Like, skipping to HIV is a little extreme.
I know this is a lot for you to take in right now, sir, but it's the safest bet to abstain from sex until we know whether or not you have HIV.
Yes, Mr. Ponce. Until you know for sure whether or not you have HIV, make sure to use condoms if you are going to have sex. Please don't donate blood. Otherwise, if it turns out you do have HIV, you may be infecting somebody else.
All right, I guess so.
According to the antibody test and lab results, Mr. Ponce has HIV. Let's call Mr. Ponce back in. I'll also be prescribing him Trizivir 1 tablet by mouth twice a day.
Mr. Ponce, I'm very sorry to inform you that your results have come back positive for HIV.
What do you mean? I can't believe this. Like, it was only one time. Like, I only had unprotected sex one time. I really need my friends right now.
Rob, I'm so sorry.
I'm sorry. We're here for you, okay?
All right.
We are very sorry. Let us know if you need anything.
So what is HIV? Like, what do I need to like what's going on?
Oh, so there are 3 stages of HIV. Right now, you're in the first stage, in which the acute stage, which your body is responding to the infection with flu-like symptoms. Also, at this time, your viral load will be very high, which will increase the risk of HIV transmission. So.
Do you have any other questions, Mr. Ponce, at this time?
Not right now. I'm a little overwhelmed. I don't really know what to say.
Okay, so your pharmacist is going to come in and talk a little bit about your medications.
All right, thank you.
Hello, Mr. Ponce. My name is Madison. I'm the pharmacist today. So I'm here to talk about the new medication, Trizivir, that your nurse practitioner, physician prescribed to you. So Trizivir is known as an HIV treatment regimen. So it just means it is a combination of other HIV medications known as NRTIs, which are the nucleotide reverse transcriptase inhibitors. So it's all these NRTIs combined as one tablet to better protect you or slow the progression of your HIV. Trizivir is made up of abacavir, lamivudine, and zivudine. It's all in one tablet, and this tablet can be taken with or without food once a day. So there are going to be a couple side effects that I want you to be aware of. So if you want to write them down, that way you know what to look for. But basically, the most important one that I want you to be aware of is if you feel like you can't breathe, if you have shortness of breath, if you feel confused, if you notice that your urine or your pee is dark, or that your skin starts to look a little yellow, that is those are signs that you may be entering into lactic acidosis. So just a buildup of lactic acid. So that is a side effect. So you want to call your physician as soon as possible so that we know we can stop the medication or what he wants to do at that point. Are you feel comfortable like seeing those symptoms?
Yeah, I'll keep an eye out.
Okay, perfect. So also on this medication, I want you to be aware that your liver and kidney function may be affected. So it is extremely important that you avoid alcohol consumption. And I know you're young and it's a lot to ask for you, but we don't want to damage those organs anymore. So just try to stay as healthy as possible by avoiding alcohol if you can. Do you feel comfortable with that? Do you have any questions about that?
I mean, it's just a lot to take in today, you know. I'm
I'm so
HIV positive,
sorry.
and now I can't drink anymore. Like, what else is gonna go wrong?
You know, you are young. We're going to try to do the best that we can. It's good that you're here and that you're, you know, very receptive to the information. So just another thing, you can experience severe anemia and neutropenia, which means your red blood cell count and your white blood cell count will drop. So that means you are susceptible to infection. So just want you to be aware that if you're around anyone who's sick or has a cold or anything like that, any family members or friends, you want to let them know not to come around you because you are more susceptible to getting sick and it'll do a lot more damage to someone who might be a little bit healthier than yourself. So we just want to make sure that we're always taking care of ourselves, making sure that we're not surrounding ourselves with people who are sick or putting yourself in that kind of situation. Also important to know that this medication is not going to cure the disease, but it will slow the progression of it.
So how long do I have to take them?
So this treatment will be lifelong unless otherwise prescribed by your physician. For the meantime, they will go ahead and let you know if anything changes, okay?
All right, thank you.
All right, so Mr. Ponce, so what we will do now is just monitor your lab values because it is very important to monitor your viral load to try and slow down the progression to stage 2 and 3. So stage 2 is chronic infection and you may not have any HIV symptoms at all. Your viral load will be low at that point. And stage 3 is AIDS, which is when your CD4 count is less than 200 cells per cubic millimeters. But that's what we're trying to prevent.
So,
Okay.
Mr. I know this is a difficult time, but I'd like to provide you with information about resources you can use for support. So here's a pamphlet.
All right, thank you.
And if you don't have any further questions, you can go up front with Melina so that she can schedule up your follow-up appointment.
All right, thank you so much. Thank you all.
Thank you.
Hi, Mr. Ponce. So I'm gonna go ahead and schedule your appointment 2 weeks from now. Is that okay with you?
All right, that's fine.
Okay. What day are you available?
Any
What
day.
Okay. All right. Thank you, sir. And we will see you in 2 weeks. Okay.
Thank you so much.
Have a good day and take care.
You too.